Has anybody heard from the resident on call?
Nope, nada.
Not I.
Hello?
Hello, is this the resident on call?
Yes?
I put 2 calls out to you already.
I'm sorry.
We have a patient here with a blood pressure of 170/89.
Oh no.
Yeah, earlier it was in the 150s.
Oh no.
Is everything okay?
Yes, everything's fine. Does the patient have...
No headache, chest pain, dizziness, confusion. Patient is asymptomatic.
Let's get them on metoprolol with a stat dose now.
Okay. How much? Doctor.
5 milligrams. Let's start with 5 milligrams now.
Okay, look. The lowest dose of metoprolol we usually give is 12.5 milligrams.
Shit. God, so stupid.
Is this your first shift?
Yeah, it's my first solo shift.
Oh, okay. I see. All right, look, I'm not a doctor, but if I were, I'd consider metoprolol, 12.5 milligrams, twice a day, first dose now.
Okay, sounds good.
What does?
Metoprolol, 12.5 milligrams, twice a day, first dose now.
Is that in order?
Yes?
Great. Thank you, doctor. Do you need me to tell you how to enter it?
Yes, please.
Okay, first thing, turn on your computer.
Oh my God. Hey, have you spoken to the new resident?
Nope. Good luck.
Every July with these stupid new residents. I hope this one can at least spell LASIK.
Hello, this is the new medicine resident. I appreciate you calling. How can I help you?
Hey, this is 3 West. I'm calling about a patient in room 314.
That is Mr. Johnson, correct?
Yes?
What's going on with Mr. Johnson?
Well, he's more confused than normal, and he spiked a low-grade fever of 100.1.
Ah, yes, I saw. You did?
Yes, I was just looking at his chart.
You were?
Yes, I try to stay on top of my patients. I saw you entered the temperature 20 minutes ago.
That's right.
He has a history of BPH, neurogenic bladder, and diabetes, all putting him at risk for developing UTIs. Any other symptoms? Well, I figured you want to put in an order for a straight cath for a urine specimen collection. Order already entered.
It is?
Yes, and I had some time, so I came down to do the straight cath, too.
Really?
Yes, I just finished.
That was the best catheterization I ever had. Didn't even feel it go in.
I'll bring it down to the lab now.
Are you sure?
Of course! You nurses are the backbone of our healthcare system. You relax. I've got this. Is there anything else I could do for you tonight?
No, I don't think so.
Okay, well, my line is always open.
Doctor, wait!
Yes?
Thank you.
Anytime. Hey, was that the new resident?
Uh-huh.
I need to talk to them. Are they nice?
They were perfect.
On Christmas Eve, a schizophrenic patient tried to dismantle the inpatient psych ward's toilet so Santa could come through and give presents. Well, isn't that just very smart? Schizophrenia is usually associated with a person who is out of touch with reality. Delusions, hallucinations, sometimes very hard to control. But in this case, very smart. The psych ward does not have chimneys. How is Santa supposed to get through without a hole to climb through? This man is smart.
You promised me the baby. We have a receipt.
It's not a receipt, it's a Venmo request.
Oh, what the hell is going on here? She's backing out of our deal. What deal? That baby is ours. We're paying good money. You try to buy a baby? We're legit. We swear. Here's cash then, okay? 20 grand.
My baby is not some patio furniture from Costco.
Ma'am, this is not legal. At all! My husband is downstairs with the police right now. They're gonna make you give us that baby. They absolutely cannot do that. Wait, you called the police? I heard someone was selling a baby? Yes, arrest everyone. Not the baby.
25-year-old female reported altercation with 2 visitors claiming to have purchased her baby for $20,000. Physical and verbal assault ensued. PD arrived, arrested all parties, excluding the baby. Baby is currently resting quietly in the nursery, blissfully unaware of the felony charges surrounding its existence. We'll continue to monitor. Save. As an ER doc, I once pulled a bunch of grocery store plastic bags, still all attached, probably about 10 feet worth, out of a 90-year-old nursing home patient's ass. I feel like a magician. That is new. What were they doing there? How did he get that many plastic bags to shove up his ass in a nursing home? They're not grocery shopping. Where do you get this? Patient sounds like the kind of person that gets their milk triple bagged. If they're still attached, it means he didn't stick them in one by one. He said, how many can I fit? And he tied 10 of them together. And he said, this is long enough. He started shoving it into his ass. While nobody was watching. He's in a nursing home. He probably had a roommate. This patient was definitely Asian. This is like something my mom and dad would do. This is something my grandmas would do. Save plastic grocery bags just in case they need it. You know what they use it for? Trash bags for our bathrooms. A woman came in after being thrown off her boyfriend's motorcycle while they were evading the police. She got thrown into an iron rod fence upside down. She was stuck upside down until fire could show up and get her down. What? When PD talked to her in the trauma room asking who the boyfriend was and where he would have gone, she said, nothing. I've never known such loyalty. Let's be honest. If the person you love is the person who throws you off their motorcycle, you definitely don't want to say anything. You also might want to leave as quick as possible. You know what the silver lining about this story is? She was probably wearing a helmet. You can't get thrown off a motorcycle, land upside down, and survive. That's the one thing we see in the ER all the time. Motorcycle accidents, generally never good. Also, always wear a helmet, even when you're biking. I don't care if you look like an idiot. Put the helmet on. PSA from ER worker, 10 years. Do it, or you die.
Hello? Oh, good, you must be Dad. Come on, shirt off. Let's do skin to skin. I got pad thai with extra spring rolls. Perfect. 15 minutes and you both can eat. Come on. Here you go.
Whoa, it's like a real baby. Crazy.
I know. Holding your own baby for the first time is totes crazy. But you'll get used to it. Honey, you shaved your mustache?
I'm here. Where's my son?
Your son? Then who are you?
Uber? I'm delivering food to room 503.
Oh. Yeah, that's down the hall.
Did you just have an Uber driver take their shirt off and hold my baby? Actually, they took my shirt off for me.
Okay, let's everybody calm down. Just hand the baby back and we can forget this even happened.
Okay. Just 5 more minutes?
Give me back the baby!
Honey, it is mine, right?
Okay, sir, you're here for a buttock pit.
Hi, yes, that's me.
Let me guess. Broomstick?
Actually, it's a sledgehammer.
Oh, you took the head of the hammer off first, of course.
No, it's in my butt.
I beg your pardon?
Hammer side in.
Sir, why would you?
I lost the bet.
Huh, it's not all you lost.
I'll say, I almost got lost driving here.
How did you manage to drive here?
Very carefully.
That somehow makes it even more confusing. Hey, I'm gonna need a portable x-ray, surgery consult, and a very brave intern. 2 very brave interns.
Can't touch this.
Roger Coast, are you here?
Excuse me, sir, do you remember me?
Yes. You fell off a bike yesterday.
And you guys said there was a small fracture in my arm.
Yes, I remember. Is everything okay?
You guys gave me my x-rays yesterday and they were black and white.
So?
I paid good money to be at this hospital and I get black and white x-rays?
Sir, all x-rays are black and white.
Really?
Yes. Oh. Okay then. Thanks. Roger Coast, are you here?
What is it that I always say? What's the most infectious thing in a hospital?
C. diff?
No.
Antibiotic-resistant staph.
No.
I think it's pneumonia.
No, you guys, the most infectious thing in a hospital is a smile.
See, this is the difference when you ask an executive director what the most infectious thing in a hospital is, as opposed to actual healthcare workers who are on the floor. They would never say a smile. They know that it's actually a disease. Unlike the executive director, they need money. She said it right from the beginning. She needs funding. So this is classic problems that happens at every hospital. Executive directors, their job is to save the hospital money and to get the hospital money, right? They're not really thinking about what's happening on the floors. Like you saw all the stuff that was happening at the beginning of the show. Patients smoking in the chair, chips falling on the ground, grandpa walking around with his penis hanging out. They're not thinking about that stuff. They're thinking bigger picture. What can we do to make this place more efficient and save money? They're also good at
12 seconds later.
Presenting why this hospital is great, not exactly why the hospital is a terrible place. So, of course, what's the most infectious thing? A smile. And that's what happens at St. Denis. Meanwhile, in the back, St. Denis is on fire.
And in the last room, we have Mr. Smith. 25-year-old male, came in last night for DKA.
How high was his blood sugar?
1,000.
Oh my god. Did you do the DKA protocol?
More like DK Slay protocol.
What was his latest blood sugar?
172.
That's great.
Yes! And now we're checking it every 2 hours.
Standing order?
Of course, Queen.
Betty, I've asked you not to call me that.
The only thing that's a little sus is that ever since he got here, he hasn't sat down.
Really?
For realsies.
Alright, well, let's go say hi to Mr. Smith.
And assess.
Mr. Smith, how are you feeling?
I'm doing okay.
Would you like to sit down?
No,
Is there a reason why?
I'm trying to get my blood sugar to go down.
Okay. I'm not following.
If I stay standing, all the sugar in my blood will rush to my feet, and when you check it again, it should be normal.
Well, that's not how blood sugar works.
But I heard you guys say you had to check my sugar every 2 hours.
That's correct.
And you said it has to be a standing order, so don't I have to be standing when you take it?
Sir, a standing order just means we don't have to get the doctor's approval every time we want to do it. But also, that interpretation kind of eats. Is that why diabetics lose their feet first?
Mr. Smith, you don't have to keep standing.
No, I want to stay standing.
Fine, suit yourself. I'll be back in 2 hours to check your sugar.
And if you're hypo on us, we will give you a Snickers bar. What? You're not you when you're hungry. Keep up.
Betty, please go home.